crown on tooth number 30. That's the second tooth from the back on the lower right side. You have some recurrent decay below the margin of your crown. We're going to cut that crown off and make an impression for a new crown today. Also, you have a crown on number 31, which is a tooth behind number 30. And you have some gum tissue in between those two teeth that is what we call a magenta color. It's kind of a purplish red to you. That gum tissue is diseased. What it is between those two crowns, you can't get in there and keep that area clean. And we're going to use a laser today to help us go in there and remove that gum tissue so that tissue will not be pinched when you get your new crown put on. Also, we'll be using the laser for our crown procedure for taking the impression. If you sit back and think about when you had those crowns placed before, one of the things that patients complain about the most is having the cord packed around their gum tissue before the impression is taken. Do you remember having the cord packed around the gum tissue? Yeah. I have more patients complain about that than any part of the procedure. So we're going to eliminate that today with the laser. Also, we might be using the laser to lower the margin of the gum tissue on the outside of the tooth so we can get it out of decay and give you a nice new margin on your crown. Do you have any questions or anything? Okay. Here's our recurrent decay. Checking our pocket and our attached tissue. Good. You can see how easy the gingiva bleeds. Okay. The first thing we're going to do here is to cut your crown off. Sandy, if you want to get your mask, and we'll cut our crown off. One of the things that we're going to use here first, Judy, is an air abrasion unit. We call it KCP 1000 Whisper Jet. And we're going to use that to cut the porcelain off, and it cuts the porcelain off faster than a burr will. Are you going to feel a little bit of powder in your mouth? That should be just about it. Your mouth will feel a little bit dry. You okay? Okay, now I gotta use a drill. You all right? As we can see the recurrent decay along the facial, and we can see the flabby tissue in the distal by blowing the air, it flaps in the breeze. See how flabby the tissue is in the distal? You can see how it flaps in the breeze when I blow air on it. Okay. What we're going to do now is we're going to remove the decay and we're going to lower the margin of the tissue back here in the distal and clean up that diseased tissue. Judy, I need to take your safety glasses and put these special laser glasses on. These will protect your eyes from the wavelengths of the laser. Are you okay, Judy? I'm going to set my machine to the energy of 30 and my pulse rate of 100. Going to enable my laser. We're going to remove this tissue on the distal. You do suction to the back just a little bit. Right there, just get that saliva. There you go, great. We can see how easily this tissue is removed, how easily it hemorrhages. The crown troughing is probably the most difficult technique to conquer. What the doctor needs to keep in mind is to do a supragingival prep, crown trough, and then lower the margins into the sulcus. Once hemorrhage starts, it's more difficult to control the hemorrhage than it is to do it the procedure the other way. With the laser, the one thing that really amazes me, we use an acrylic temporary. When they come back 2 weeks later to have the crown cemented in, the tissue looks wonderful. We don't have the mangled mess that we used to often see when we were packing with cord. Sorry it's taking so long. This tissue is really diseased back here. Okay, what we have here, we've removed that flabby tissue in the distal of number 30. I've also thinned out the mesiofacial of number 30, and we've troughed around our crown. And we're starting to get a little saliva to roll back into where we've done our troughing. Now we're ready to take our impression. Okay, we can take our safety glasses off and our mask. And Judy, I'm going to go over some post-operative instructions with you. We're going to put a temporary crown on your tooth, and it's going to be on for 2 weeks. You'll come back in 2 weeks and get your permanent crown cemented. At that time, you shouldn't have any discomfort around your gum tissue, and your gum tissue should look perfectly normal. In the meantime, I don't want you to be chewing on any tacos, any Doritos, any popcorn, or any kind of sharp chip. There's a protective layer that's going to be over top of that gum tissue, and we will need to preserve that. You shouldn't have any discomfort, but if you do ibuprofen, 800 milligrams, 3 times a day, make sure you eat first to be more than satisfactory. Do you have any questions? What did you think about using the laser for troughing around the crown versus packing the cord?
That was good. It was a good procedure. I thought the procedure was really good. There was no pain or discomfort, and it was good.
An advantage to the procedure that we just did is that we can do the gingivectomy, the crown prep, the impression on one visit. The doctor can sit at chairside and take the impression without having to get up and walk away and come back 5 minutes later. The advantage to the patient is they save a trip to the dentist and they saved an injection. As you can see right here, we can visualize our margins very easily. Okay, this is Rachel. She's 10 years old. As you can see, she has a diastema between number 8 and 9. She has a pretty good frenum. More importantly, she has a nice fibrous band between 8 and 9. Right there. That's what we're going to take out. And we're going to cut across through here. Okay. For this procedure, you can do it under topical anesthesia only, diclone 1%. For Rachel's benefit, we've already administered lidocaine. And we're ready to begin our procedure. All right. Ready? Rachel, we're going to put some laser safety glasses on. Would you put these on, please? They're your Elvis glasses. Rachel has been in an Elvis video previously. Jennifer, do you hand me my mask? Okay, we turn our laser on. Power's up to the lowest possible setting. That's a safety setting. We're going to set our energy on 30, and I'm going to set the pulse rate at 100. I'm going to do this because we have anesthesia, local anesthetic administered. We're all ready to begin. And make sure my fiber is about 3 to 4 millimeters long past my cannula. Before we begin, we're going to carbonize the end of the fiber. This creates a hot tip effect. Okay, open just a little wider, Rachel. Okay, Jennifer, we're ready. Here we go. Rachel, you might just feel a little scraping as I go along through here. How you doing, Rachel? You doing fine? Okay, open a little wider, please. There you go. Okay, can I have a mirror, please? Open real wide, please. All right, now we're going to go over here to the front. Okay. As I'm going along the fibers here, I can feel the lip release. Are you doing good, Rachel? One thing to note in this procedure, do not see any hemorrhage. We're almost finished, Rachel. Okay, I felt absolute release of the lip. We removed the fiber span between 8 and 9. How you doing, Rachel? Okay, Rachel, before we started this procedure, you were a little bit apprehensive. Did you feel anything during the procedure? It's a piece of cake, right? Do you have any questions? Okay, there's a few instructions you have to follow. I don't want you, young ladies in your age group like to take the lip and show it to their neighbors and their little pals. I don't want you to do that, okay? And I don't want you to chew on any sharp chips like potato chips, nachos, taco shells, and no popcorn. Okay, and you shouldn't have any discomfort whatsoever from this. Do you have any questions? You were a great patient. Rachel, how do you feel?
I feel good.
Did you feel anything during the procedure?
No.
Did you feel any heat?
No.
Did you feel a little bit of scraping?
Little.
Okay. Would you do it again?
Yeah.
You were a wonderful patient.